Hi, everyone. This is Tom Salemi, Editorial Director of Device Talks. Welcome to today's webinar, Are You Ready for the Rise of Virtual Care? Brought to you by Medical Design and Outsourcing and our great sponsor, Catalyst UX. It's a premier design firm for medical and life science companies. Before we begin, we've got a few housekeeping issues to go over. We will be making this webinar available at medical design and outsourcing.com webinars. You probably could have figured it out anyway, but I'll say it. Medical design and outsourcing.com webinars. Use today's login link for your on-demand viewing. So if anyone on your team has missed this, but wants to catch up on the presentation, as they should, they can view it and they can even ask questions. We'll also have a Q&A session at the end of the webinar, and we could certainly look at questions during the presentation, but certainly at the end of the discussion, we'll be able to clarify any points or answer any questions that perhaps we didn't get to during the presentation. If you have any technical difficulties during today's session, simply ask for help through the Q&A box on your On24 console. Also, please share information about this webinar on social media. We'd love to get a broader discussion going. If you tweet or post this on LinkedIn, feel free to use the webinar hashtag MDOwebinar, and you can get direct contact information for me and for our panelists through the contact window. So again, with the questions, just enter your questions as they occur to you in the Q&A window. We'll address as many as possible during the discussion, and we'll certainly follow them up at the end. So before we begin and before I interview our great panelists, I want to remind you that for up-to-date news and analysis and product information on medical devices, visit Medical Design and Outsourcing magazine. And thanks again to our great sponsor, Catalyst UX. Now I'm happy to bring our panelists together for this conversation. We have today Paul Giarata. He is the president and CEO of Catalyst UX. Paul founded the firm in 1994. And prior to that, he worked at Apple, which must have been a really interesting time to work there, where he led multimedia in education. And he worked with such clients as Thermo Fisher, Bio-Rad, and Roche. And also joining Paul on the present today is Rebecca Davia. She is a lead user experience designer at Catalyst UX and the medical device and life sciences practice. She has over 12 years of experience designing web, native, mobile, hybrid, and desktop applications, and she's led design for projects for Roche Medical, Omnicom, Boeing, and Thermo Fisher. And before working here, she worked at Harvard University, GE Healthcare, and Oracle Commerce. We have a really great pedigree for our panelists today, bringing lots to the table. Now, I know, Paul, you're going to be our lead-off hitter, so I will hand the yellow triangle over to you, and I'll enjoy this presentation from the sideline.
All right, thanks, Tom. Okay, so I'm going to cover off some background information on this whole topic around virtual care, and then Rebecca's going to show some examples. So let me just go ahead and jump in. So today, what we're going to cover is four particular things. One is the growth in virtual care, which has been hugely stimulated by the COVID-19 pandemic. We're going to take a look at where are the growing sectors, where are places where people tend to gravitate toward virtual care. The other area, or another area, is a strategic framework. We want to toss out what we think could be a strategic framework for you to kind of organize your thoughts and your thinking about what your organization can do in virtual care and what makes sense for your organization clinically and from a commercial perspective. And then the last part of it is to provide you with a mechanism, so again, a structure so that you could define your own strategy. So let me give you a little bit of detail on it. So first off, this virtual care area has exploded, and prior to this, it was heavily impacted, but it is now a very sizable market that in 2019 was $21 billion. In 2026, it's forecasted to be $95 billion. So wow. It's really an area where people are going to want to pay attention to, want to see how they can get involved in it, whether they are payers, providers, drug companies, kind of all across the whole medical community. Okay, so COVID-19 was a watershed event as it relates to virtual care. Prior to that, there was not a lot of awareness around virtual care. There were questions about, well, what's it cost and can I get reimbursed for doing it? And there wasn't a lot of reimbursement. There were questions about, well, what's the quality of the care? I know my doctor. I selected my doctor. And people have confidence in that. And then the other thing was people had a desire, I just want to talk to my doctor in person. Then with COVID-19, there were some key changes, some key events. One is government regulation got relaxed, and now it became reasonable to do a telehealth conference with your doctor via any number of different devices. It could be Zoom, it could be FaceTime, any number of things, so that it would allow organizations to reach out to their patients via a telemedicine type of consult. The other thing that took place is the consumer preference. No one is wanting to go into and sit in the doctor's office right now for an appointment. So there's a strong desire to, number one, not be going to the care provider's location, and then number two, to stay out of the hospital. The third one is really how hospitals have been impacted. They have just been so financially impacted from two things. Obviously, serving patients with COVID-19. And then the other part of it is that the elective surgery, people are just not wanting to do knee replacements, hip replacements, any number of elective surgeries because of what's going on now. So if you look at what the impact was of COVID-19, you can see it on the two right bars. Okay, you can see in January and February that the two lower numbers were 2019 and 2020. And it pretty much tells a story, really flat, not a lot of activity going on in telehealth. There is some growth. It's true, there is growth in it. And it was growing, but still not a significant amount of activity. And then you could see what happened in March and you could see what happened in April. There is just explosive adoption of telehealth as a way to reach out to patients. And the impact of that is by the end of 2020, there will be over 1 billion virtual care visits. So this whole virtual care area has just become front and center. And it has all of a sudden become the way that people want to be able to access care, not for all things, but there's a very significant demand. It's not dissimilar to what we have unfortunately been experiencing in our schools, where all of a sudden distance learning was not a favorable topic, not something that people were paying a lot of attention to. But now it is the primary way that many of our kids are receiving their education right now. Okay, so when we peel the onion on this virtual care, there are a couple things about it. One is there are two particular areas where people tend to want to access virtual care. One is complex needs. If people have complex health situations that they're dealing with, they tend to want to rely on virtual care. And the other one is chronic disease management. So let me give you a little bit of detail. Here's some data that Accenture published, and the purple figures are people that have consumers with complex needs. And the other one is people that don't have major health needs, that they have a few health issues, minor things, kind of routine things. And you could see across the whole range there, from routine therapy to physical injury to cancer screenings. In all cases, people with more complex needs tend to want to seek out virtual care more regularly. Then there's obviously another big area that with, I'm assuming most of the people, if not all the people on here, are in the medical and life science world and are well aware of the burden that we have with chronic conditions, where 50% of all Americans have at least one chronic disease. Chronic disease counts for, that actually number is actually wrong. It's about 50% of all healthcare spending. That number moves around. It depends on what you, on where you look and how you calculate what the top chronic diseases are. But it's a very large amount of our medical spend, and it's a very large amount of our population. And then 7 out of 10 deaths are due to chronic disease. So this is a key area where in your organization where you may be reaching out to people with chronic conditions, or you may have a drug that addresses chronic conditions like cancer, like diabetes, or congestive heart failure, that dialing in on how the virtual care could be specifically tailored to the people with these chronic conditions may be very valuable for you. So, you've seen this list, and the list moves around. And if you looked at the top 10 things and you organize them by dollars, you could see, the dollars are huge. It's about 50% of the spend. Whether that's the top 10, there are different ways to look at it. But what we do know is there are people with these chronic conditions, and in many cases they have more than one chronic condition, and they have great regular ongoing needs for care. Okay, so then you step back and say, well, how do you think about building your virtual care offering or your virtual care strategy for your organization? And again, you may be an organization that's a provider, and you may have a community of people that you provide care for. You may be a payer, and you might have members that you need to think about, well, what can we do in virtual care? And how will that virtual care strategy have impact clinically and also commercially? Or you may be, let's say, a drug company, and you've got a number of drugs in different areas, and there may be, when you go through drug by drug, there may be certain things you want to do related to virtual care in one or the other. It certainly has the potential to really address the fact, to chip away at many of the challenges around adherence and the poor conversion of prescriptions into people being on drug, where in the U.S., the number they quote is only about 50% of prescriptions ever get converted to people actually really using the drug. So how can you think about it? Well, there are 4 things that we wanted to mention about it. The top 2 items in that diagram are sort of the 2 key building blocks. You look at this patient care continuum, which will show you, and you look at this idea of virtual care channels. When do you make things available, and when do you not make things available, and what do you make available? And then what we would encourage you to do is to look at it and say, well, what's our current state, and where would we like to go? And once you determine where you'd like to go, then a big part of that discussion is, well, what will be the clinical impact of that virtual care activity, and then what will be the commercial impact? And I think it's important that you really look at those individually. Okay, on this care experience continuum, I'm not going to show you anything that you haven't seen before, but for those of us that are kind of in this world of designing and thinking about solutions, we may not look at it as a continuum, but individuals go up and down what you see as this continuum. Hopefully we spend a lot of time thinking about lifestyle and wellness. Is our diet where it should be? Are we getting sleep? Are we getting exercise? I'd like to spend a lot of time there. Then there are a set of as-needed therapies. Someone might need help with sleep therapy. They might need help with weight management. They seek out those therapies, then they tend to go back to their lifestyle, regular lifestyle. And then obviously we all know there are event-specific issues. Something happens, there's an injury, someone goes to the emergency room, or there's an elective procedure like a knee replacement, or a hospitalization. People tend to deal with those events, and then they go back to their lifestyle. And then the last one is, unfortunately, when people enter this situation with chronic conditions, more than likely that's something that they are going to need to manage for the rest of their life. Not that some people don't move out of those chronic conditions, but it tends to be something that impacts their lifestyle. So from a virtual care perspective, what we really need to be thinking about from an experience viewpoint is individuals, and I won't call them patients, because at any given time, people don't necessarily think of themselves as a patient. They think of themselves as an individual trying to live a healthy life. They are marshaled up and down this continuum, and a lot of times they don't have control over that. Things happen and things get prioritized. So they may love to do Fitbit challenges for exercise, and that's really a great thing. But at the point where they have taken a bad fall and have broken a bone or something like that, well, they're not going to spend time on Fitbit. They're going to be in the emergency room. Those are the things they need to deal with. They need to deal with the resources that will let them deal with that. So this is a framework that we would suggest that you look at. The other part of it is, on that framework, is there's this idea of virtual care channels. And again, this is just an organizing principle. Just like on your television set, the channels organize the content that you have access to. And so in your organization, you may have a set of things around monitoring and evaluation that you make available to certain people. Could be specialized assessments. It could be for collecting patient-generated insights. And you might have other areas like for helping people with medication management. So the way we look at this is sort of the extent of the virtual care capabilities. And our sense on this virtual care, developing our strategy, from talking to people, I think most people think of it more narrowly than what they can actually do. A lot of people will think, well, virtual care is just telehealth. Well, it's really not. I mean, virtual care, it can be much broader. And I think you want to look across this and say, what things do we want to deal with? And then the notion about these channels is kind of time-based, and it's based on who you want to provide this information to. So last slide I want to share with you, and then I'll hand it off to Rebecca to show you some examples, is how do you put this together to build your own virtual care channel strategy? It's a combination of you look at down these care channels, which you could see on the left, and then in your organization, you decide how you want to organize this. If you're a provider, you would probably organize it around this care continuum. If you are a payer, an insurance company, you may organize it around member groups. You might organize it around employees. You might organize it around employer groups. And then if you're a drug company, for example, you might organize it around certain drugs. So let's say if you were developing your strategy, virtual care strategy, and it was a drug company, you might go drug by drug and say, well, where are we currently on these things, these potential capabilities, and where would we like to be? Where do we think we would like to be as a strategy to get a sense of that? So that's kind of the model that we wanted to present. And what I'd like to do that will make this seem a lot more, probably a lot more concrete in the whole discussion is to turn it over to Rebecca. She's the lead medical practice lead at Catalyst, and have her show you some examples of this virtual care. Rebecca?
Thanks, Paul. Hi, everyone. All right, I have to get my trigger finger working here for the slides. Okay, so next we want to take you through some real examples of virtual care that we have, solutions that we have designed. We're going to take you through several different types of examples. The first would be high-cost specialty drugs. The next will be a digital companion for congestive heart failure, one for remote cardiology consultation, the Mayo Clinic Three Forks, the Three Forks Wellness Ranch in partnership with the Mayo Clinic, and a COVID-19 digital companion example, a medical device example, better night sleep therapy, and home evaluation for Medicare patients. So you can see just from this list that the model really easily and readily adapts to lots of different kinds of scenarios. So the first is high-cost specialty drugs, and in this case, the customer needed a digital solution, essentially, for virtual care for those people dealing with rare and chronic diseases and having to take high-cost specialty drugs. So there was really a need to engage with the person quite regularly. There's a really rigorous and difficult onboarding process. And there was just a need for a digital solution to facilitate all of that, from education to onboarding to adherence, which we'll see as I go through the example. So the first step, having looked very closely and carefully at how digital technology can be a real solution for people that helps them and engages them, and also brings meaningful insights back to the drug manufacturer, the servicer, so that the whole process can continually be improved upon. This was the challenge. And we believe that it begins with people really understanding and educating themselves about their diagnosis and their treatment. So here, people are presented with curated content by the servicing team, and the content is driven by AI to recommend content related to the person's interests. And here, people can, rather than searching Dr. Google, can come and freely explore vetted and curated content that they are interested in. We felt it was really important for patients to understand the specific steps in their treatment, which is quite complicated. So many patients, and I count myself among them, leave a doctor's office or a hospital without really a clear understanding of the everyday nitty-gritty details of their treatment, especially if they're getting a diagnosis for the first time. There may be emotions involved, and just purely the fact that so many instructions are rattled through so quickly. So people have follow-up questions, and again, this is a place that they could come to understand the specific and individual steps of their treatment. I mentioned earlier that often for these high-cost specialty drugs, there's a very complicated and lengthy enrollment and onboarding process, lots of required documentation, lab tests that need to be taken, scheduling, and oftentimes, people, especially if their condition is prohibitive to functioning in their daily lives, it's difficult to have to put all of these puzzle pieces together and make all the right calls and show up in all the right places. So a digital solution is really perfect for this, because in one place you can have a timeline of where you're at in the process. You can have, reminders of what's coming up next. You can view your lab results, and you can fill out required documentation right here. And so it's all in one place and much easier. And you can see, I hope, in the upper right, there's a little, what looks like a chat bot, and I'm going to introduce this concept for the first time, and I'll expand more upon it later. But this is a health coach, so this entire experience is really a high-touch experience. So it's not only a digital solution, but the idea is that there's someone on the other end who's been trained appropriately that can assist people through these kinds of processes. And then finally, during the adherence phase, this is a place that really is exciting, because for the first time, pharmaceutical companies, physicians, a myriad, the care team in general can, for the first time, have insight into their people's daily lives, and because after a prescription is filled, the statistics are staggering, because only 14% are taking people are taking their medications as prescribed after a year. So the power of a digital solution, a virtual care platform, is that by creating this ongoing engagement with the person, you can you affect those numbers quite drastically. And one really powerful way to do that is to have this sort of intermediary person that is not the physician and is not necessarily a part of a person's care team, such as a parent or a sister or a daughter or a son. But the idea is that there's a health coach or a concierge that's facilitating the patient through their treatment process and has insight into whether or not the patient is taking their medications on a daily basis, whether or not they've had enough activity, how their nutrition is going, how their community is going, and can engage with the patient as often as the patient is interested in engaging, and can also be provided with a sort of stratified list, a risk stratified list of patients. So those patients that maybe have been flagged for being at risk for missing 3 days of medication, or having missed an appointment, for example, the health coach or the concierge can then reach out to the person and just check in and say, I noticed this, I noticed you missed 3 days of medication, etc. But the health coach, is certainly a trained professional, and virtual care provides the health coach with insights and AI to help them give consistent recommendations, as well as to identify the flags via the risk stratification. Paul, anything you want to add to that, health coach?
No, I think that's got it. I think it's I think it's a good point, and you did reinforce the point that we really view that high touch part of it, high touch experience is a key part of the experience.
Great, and again, a digital solution makes this quite easy through enhanced communications. Telehealth is in the palm of all of our hands at this point. And again, all of it could translate to be in the palm of either a patient's hands or their care team. So a family member who's helping out could potentially have access to this and be also on top of and aware of and have a schedule at their fingertips as well.
Yeah, Rebecca, just to add one comment in this, that what you're seeing here are examples of existing functionality that are being pulled into this environment. So blood test results may come from someone like Quest. Other things like for scheduling with in-home healthcare may come from another source. So we very much view that when you do this virtual care, that number one, you want to have it be one experience. You don't want people bouncing around, going in and out of different applications. However, we feel it's very important that are able to leverage the current assets and capabilities you have and sort of logically pull them into the environment in kind of this well-organized way, which you see on these cards here, to accomplish that.
And again, this is so exciting because drug makers, as well as a myriad of organizations now, for the first time, have insight into real data about their specialty drug patient population, such as which steps in the process patients are falling off, how much revenue is lost to therapy abandon, and any other insights that might help them both improve the process and show through, demonstrate patient-focused drug development. We're going to skip this slide. And as Paul was saying, the systematic integration of the third-party functionality varies from not only health record integration, but and I'm not, when I say health record integration, it's a hot topic, so I'm not saying that the entire electronic health record should be integrated with this kind of a solution. That is a whole Pandora's box. However, certain types of that could be integrated, such as scheduling, and then certainly any of the patient's own wearable data is quite easily integrated with this type of a platform, giving insight into activity, nutrition, heart rate, all sorts of important information, giving the full picture of the patient's health. And then finally, we felt that it is critical for to include a component of community. So, what may seem obvious and has recently been verified in studies is that people desired to be in community with others in similar situations so that they can learn from them, sympathize with them. And we know that places that create community, even digital places that create community, are trusted places. And these are the places that people come back to every day. And the community that's demonstrated here is a community of online, perhaps previously anonymous people that have similar conditions. But also in earlier slides, we showed a community with the patient's own family members and friends, so that family members and friends could have a sort of light version of this, if you will, where they could engage in communication with the patient. All right, that is the chronic and rare diseases example. I'm gonna let Paul take over on the digital companion for congestive heart failure.
Okay, so this is an example that was a piece of functionality. It's purpose-built around a particular condition, congestive heart failure, and a specific drug. So the modeling, an important part, so what you could see here is there is data that is being collected and adverse events that are being tracked, which, by the way, adverse events is always a controversial thing that may or may not, people may or may not want to collect. People are interested in collecting patient-generated insights, and that's one of the things that these virtual care solutions can do for you. And in this case, there was also the presentation of custom content. So it's a general theme. And when you look at this and we talk about that notion of channels, this heart rate information content, which gives them details about heart rate, they're able to learn more about it, is a channel. It's present or not present. It shows up at certain times. It doesn't show up at other times. This medication one is, again, another channel for tracking things and helping with medication management. Same way with collecting this wearable data on sleep. So this is an example of this channel notion being in place. The user doesn't perceive it as quote unquote channels, but for you folks, in terms of thinking how you reach out to someone. You could think about, well, at some point we may want to present them with a piece of content, and we make it available or not available, just like programming on a television channel. And these are kind of turned on and off. And the other characteristic is that they're going to take advantage of functionality that you already have in your organization. Here's an example again of capturing adverse events. Okay. The other thing I would say about that, I know that there was a question about would we expect that this sort of virtual care to be incorporated into medical devices? And what I would say is I think that I wouldn't characterize it as seeing it being incorporated into medical devices, but I would see that there may be output of medical devices. Like, let's say it was for radiology, where the imaging you want to be in a format that it can be readily incorporated into these environments. So I think it's safe to say that for those of us working on medical devices, the outputs and the interaction of that, we might want to have it so that we can anticipate that the results of that can be made available in a digital environment, one of these environments. And then the last thing I'll say about this that we think is really helpful, we think of this as a digital companion going beyond what a mobile app is, in that there is there's a person, a coach that is available. And it's that combination of this digital experience and this high touch experience that really does make it a quote unquote companion for the patient, a companion for a drug or a condition.
And I'm going to hand it back over to Paul for the COVID-19 example.
Yeah, this is an example of something that we designed specifically to respond to COVID-19 and to enable people to, individuals, families, employees, both providers and just general employers to do a specialized assessment and collect information and track it. And so again, it's organized. It's this idea of a channel, like what you're looking at is a channel for an assessment. And the assessment occurred every day. People didn't have to do it every day, but they could do it every day. Then the other part of it was to be able to have some personalized analytics, something actionable. And in this case, what you see on this COVID-19 solution is it's a 14-day trend. And this is what we've all been trying to do, is make sure that for 14 days we are staying clear of being around people, we're not having symptoms, and then we could track certain things where it's like, yeah, I actually did go down and to the Mexican restaurant and get a margarita, and I sat next to somebody that was coughing, and you can keep track of that stuff. So the idea here is, in a digital environment, you try to think about, well, how can I present this back to the individual or the patient in a way that is meaningful. And then the other part of this that was very important for both employers, for like insurance companies, you could see this is for Blue Cross, is to be able to understand their member population, get the population health data on what is taking place inside their member population and where the trends are across different groups. So what this virtual care does do for organizations, particularly providers, and for pharmaceutical companies, it gives them data that they've never been able to have access to. And it may be anonymous data, but it's still population health data that can be very helpful for people. Okay, Rebecca, I'll turn it over to you to talk about sleep therapy.
So this next example is a companion for a medical device therapy. For a sleep therapy that combines medical devices and remote diagnosis via telehealth with medical professionals as well as ongoing consultation. So again, personalized insights were key in this. People could go through a fully online process. So I could live in, Boston and go through this process completely remotely, and go through questionnaires, meet with a medical professional via telehealth, be diagnosed, be sent my device in the mail, and have remote diagnostics reported back. And the entire cycle is completely virtual. So this model lends itself really well to things like specialized assessments, where these cascading questions that dig deeper and really try to narrow a diagnosis. The entire insurance process was also completely handled through this solution. So I can enter my insurance information here. Better Night performs the check on it on their end, gets back to me in a few days, and bam, I'm either approved or I maybe have a copay that I could pay right here. And it's just all handled here, and I'm not, chasing down 15 different tabs in my browser. Let's see. Anything else to say about this example? It fully took the person through scheduling for the consults, and through even setting up their devices when they received them. So, this central panel, instead of being about health insurance at this point, it's, instructions on how to put together my device. So again, lends itself really, really well to the medical device model. And Paul?
Yeah, so this last one is an example of a tool. It's tablet-based, where home healthcare providers can go into the home and evaluate Medicare patients. And it was intended to obviously deal with people so that they didn't have to leave their homes. It replaced a touch tone telephone system where people had to go sit near the phones, and the experience could be anywhere within reach of the phone cord. And but it was also designed to have some involvement where you could be talking to a person and say, well, can you describe your injury? Can you point to where it hurts? And it could involve the person in the experience. So a part of this virtual care, one part of the design is that you're thinking about, well, what is the experience you're trying to have between the provider and between the patient or the individual? And they may be together or they may not be together. And in this case, the provider was going to the patient, okay, as opposed to the patient going in. Just another example of it's not a pure digital solution, but where the digital capability really complemented the way that that care was being provided. And I think that's the last slide on that one. Okay, I think we're ready to open it up for Q&A.
Oh, great. Great presentation. Lots going on in that space, obviously. I'm just curious, do you see COVID, it obviously accelerated the adoption of sort of virtual healthcare and telemedicine. Has it accelerated innovation, or are people developing new ideas faster, maybe to fill gaps and overcome shortfalls of existing technology, or has the infrastructure we currently had worked well enough?
I think it's definitely accelerating innovation. I think what's happened is the demand for virtual care is profound. And so with that demand being there, I think it will really drive a lot of innovation. And I think there are a lot of things, like if you go back and look at some of the older telehealth solutions, I think when people look at it now, they're going, I'm not going to do that. I'm not going to go through all that, everything there, and a copy of my driver's license and charge my credit card and then do this. And, people, people are wanting it to be simpler. And I think there's big demand for that.
Absolutely. Okay, first question from the audience we've had. Someone asked regarding COVID-19 again. In the case of the example you cited, the patient inputting the information, it all seems self-regulated, which is fine. But any thoughts on whether we'll be using the actual wearable devices that are designed to measure respiration, temperature, et cetera, and using those to sort of track the disease?
Yeah, absolutely. I think there's a big move to be able to identify a particular chronic disease area, let's say COPD, and have people have the ability to get insurance reimbursement for an oximeter that would track their oxygen level. And it is a wearable, it's not quite a wearable, but it is a Bluetooth device that will capture it, and it goes into that particular solution. So I think that the idea of using those wearables will definitely increase, and the idea of incorporating them into a solution for a specific chronic condition will increase. I also think that what we're seeing, because we're doing some projects right now with some very significant players that are nationwide players, that insurance companies are now starting to reimburse for those certain wearable devices under certain conditions, which is a key event to help drive that.
So just curious, I mean, Apple announced that the Apple Watch 6 will be measuring oxygen. Does that going to come close to being a reimbursed device, or are you talking about something much more intense, something really more clinical for a clinical setting?
Well, it's a good question. So on the Apple 6 watch, or even the Apple Watch and the current Apple Watch now that you could track for AFib, for people that are as diagnosed as having COPD, they may be able to get that Apple Watch reimbursed as a part of their treatment. Not for people generally, but I think it's tied to the condition. And then for the condition, there's starting to be more and more openness to doing that. And part of it is that a lot of it is it's the individual insurance companies that can make a decision. For example, Aetna makes a decision that, I think it would be helpful for us to, for people that have congestive heart failure, for them to be able to monitor their own AFib condition. That's better for us. They can make that decision to allow for that reimbursement.
Well, Rebecca, it seems like a pretty easy metric that if your watch goes down to whatever, 96 or 95, you'll be prompted to get yourself to a hospital or someplace. It seems like
absolutely. Especially with push notification capability that might not reveal sensitive medical data, but would prompt you to open the app.
Absolutely. Well, one of the challenges I think we have in healthcare is just all the systems we do currently have, all the legacy systems. How do we bring those into the 21st century effectively? Are there fixes and patches, or are we just going to have to replace everything wholesale or bit by bit as equipment expires?
Well, our sense of this, because a lot of the projects that I would say almost all projects, unless they're brand new greenfield projects, are using existing capability to some degree or another. So I think, so from our viewpoint, number one, it's got to be a unified experience. You can't have people logging or moving around to different experiences. And we know this emphatically from what we dealt with the sleep therapy, when they shifted to using a different telehealth provider, and it was a completely different experience, and people were confused. They just couldn't do that. So our mantra is it's got to be within one experience. And then the other mantra we have is to be able to make those pieces of functionality, expose them in that experience kind of in a logical way where it's an organized fashion. It's a little bit like putting appliances in a kitchen. You may have a really old blender, but when you want that blender, you take the blender out and put it on the counter, and it's effective. So when we certainly don't, we think on this terms of developing this strategy, the idea is certainly for companies to think about what do we have now that we could bring forward and incorporate, So we're definitely not thinking that people are going to replace everything. I would say there will be a point where people will need to plan that this virtual care experience is an ongoing living experience like any digital health, any digital device, and it will need to evolve over time and get updated.
Interesting. We've got about 6 minutes left, and Rebecca, if you want to add to that, it's fine, but let's have some other questions. We have one or two questions from the audience, but if anyone else would like to submit, I'm sure we'll have time to get to them. So make sure you do use the Q&A box. Rebecca, I think it was you who sort of talked about the pharma, the role with this in pharma. Have you seen anyone doing work with virtual clinical trials?
So we haven't seen any concrete products coming out, I'll say.
Yeah.
Clinical trial. However, we firmly believe that this model absolutely directly applies to clinical trials, and really could help facilitate the advancement of clinical trials that might be completely halted because of COVID at this point.
Mm-hmm.
Now, what we are seeing happen is that there's tremendous demand in clinical trials for getting a more balanced population, balanced sample representation. And then also the FDA is put into a lot of the need to collect patient-generated outcomes. So we are seeing companies using these virtual care capabilities to address those specific things. And so that they can build confidence with minority groups, provide them with valuable information, and have them feel comfortable being part of trials, as well as collecting the data.
That's a great point. I was talking with a CEO the other day, and he mentioned that the possibilities of, N equals 1 million are there, that we could get to a point where our clinical trials just become much more robust.
Yeah.
Question from the audience: are there someone asked if there are other capabilities that might be included in the care channels that you didn't cover. Anything you missed? It was a thorough presentation, but there's a lot out there.
That's a good point. That was just an example of things. We think that's a fairly exhaustive example based on the work that we've done. But what we would say is, if we were going to work with somebody on doing kind of a strategy workshop for them specifically, which we'll do, at no charge, we would vet out which of those care channels make sense and are there other ones. And I would absolutely anticipate that there may very well be other care channels that make sense that you want to add in there. And I think the other part of it is that what you're really looking for is you're looking for the functionality and capability that's high value, and probably less is more valuable to people than having it be an exhaustive. So it's kind of like your TV. I mean, 760 channels is, that just doesn't have a lot of impact when we probably all watch maybe 4.
Yeah, and then we complain that nothing's on. Question from the audience again. How do you see the competitive landscape of UX between the major players offering telehealth solutions?
Well, I think that in the telehealth area, I think what's happened now that they've relaxed the regulations on it, and you could use something like a Zoom, or you could use something like a FaceTime, I think there's going to be great demand to simplify and have the experience be very effective. Because if somebody uses something like, I won't mention any names, but, if you have a registration process where you have to go through and copy your driver's license and submit it, send a credit card in to verify that it's you and do this. And at the end of that process, they say, oh, I'm sorry, there's no one available at this time. People are going to walk away from that experience. So I think for the telehealth providers, there will be a tremendous focus on really figuring out how to simplify that experience and making it very accessible. And the more easily accessible, the better it will be. There is another part of that telehealth experience, which is on the provider itself. There is some finesse that in terms of people being able to deliver those professionals, medical professionals, deliver those effectively. You know, people want to see you, and what the person is wearing makes is relevant. Having a stethoscope around your neck probably isn't quite relevant for us. But it's important. And like I did a session with my physician who was moving to another location, and he never turned on his video, and I'm going, well, we missed a huge opportunity to be able to connect. So I think simplification, and I think there will be a tremendous amount of demand and competition for making that experience very high quality and very simple.
We'll have physicians will have their diplomas as their Zoom backgrounds.
Right,
so
exactly.
Final question, because we're just about up against it. We talked a lot about the patient journey. Maybe Rebecca, you can talk a bit about what impact does this have on companies, on staff, on payers? I mean, it's easy for us to say we're not going to the doctor's office anymore, but that's how we're impacted. But the offices are impacted as well. How do you manage that side of things?
I'm struggling a little with the complexity of the question. Can you just repeat that? So the question is, I'm sorry.
Sorry, no, I got it. My mute button was jammed for some reason. So you reviewed the patient journey with us. How do you help companies incorporate staff and payers and et cetera?
Okay. So this is a many-layered onion question that we won't have time to answer in a minute. So what I would say is that, specifically in the example of the high-cost specialty drug, the company that we were working with was sort of a third party to pharma. So they had a lot of internal sort of business practices and strategies already that we certainly took digital. And so in terms of manual practices or disjointed practices, we helped them centralize, such as call centers and so especially with the onboarding process.
Mm-hmm. Interesting. Go ahead.
Hey, Tom, let me mention.
Go ahead, Paul.
Let me mention this last thing, because I know we are out of time. If for those of you that are thinking that there may be a role for this virtual care strategy in your organization, the outcome of this is if it is potentially valuable for you, we'll do a separate session with you and spend 90 minutes and help you put together that strategy and get that framework in place. And there's the contact information right there. And it, like I say, if it's of value to you, we'll help you kind of move to the next level and get it dialed in specific to your organization.
That's a great way to end it. You can have your own personal webinar. Yeah, I won't have to stand in between and moderate anything. So I think folks should take you up on that. Well, thanks, Paul and Rebecca, for your time. Thank you, Catalyst UX, for being a sponsor. Please, attendees, if you've identified something that someone in your company should know about and they want to see this presentation, it is available on demand at medicaldesignandoutsourcing.com/webinars. You can register for it there. And you can also ask questions, and we'll make sure those get over to Paul and Rebecca. And of course, if you're looking for news and analysis of the medical device industry, please go to Medical Design and Outsourcing and Mass Device. So again, thank you, Paul and Rebecca, for joining us, and thank you for everyone who attended.
Thanks for your time, folks.
Bye-bye.
Bye.